Welcome everyone to the controlled drug delivery device for tongue oral mucositis, OraLyptus. Comfort with every patch. Here's the problem. Oral mucositis is a debilitating complication that occurs in patients that undergo chemo and radiotherapy. It includes inflammation, redness, and massive ulceration. 1.9 million patients are diagnosed with cancer yearly. 650,000 of them undergo radiotherapy, while around 1.1 million of them undergo chemotherapy, with a 77% increase of cancer patients by 2050. How many patients are affected by oral mucositis? Well, greater than 80% that undergo whole body or local radiation therapy, or 50% of chemotherapy patients develop it, according to the Cleveland Clinic. We sought input from clinical and business specialists, but the most relevant and important individual that inspired this project is my grandma, Emilia Tomareva, who developed oral mucositis after undergoing immunotherapy for her molten lymphoma in her eye. The device objectives here include the prevention of onset tongue-specific oral mucositis and also symptomatic management by reducing ulceration, deterioration, and oral thrush. Here's design concept number 1, design concept number 2, and design concept number 3. Each concept was developed by a member of our team, and the design specifications are outlined here, the best of which will be applied to the final product. So what is oral mucositis? It's a handheld medical device that treats oral mucositis on the tongue for patients that undergo chemo and radiotherapy. It includes a peristaltic pump, rechargeable lithium-ion battery, disposable tongue patch, and is patient-operated and switch-activated. Here's the electronic components. Here are our deformation profiles that were simulated in COMSOL multiphysics. Here's what it looks like when operated on a benchtop view, and here's what it looks like when it's held at height level. We also developed our own drug formulation to improve tissue repair and regeneration, improve symptomatic management, and add anti-inflammatory agents. These are the drug delivery effects and therapeutic windows that we calculated. Here's what the initial prototype looked like. This is what it eventually ended up looking like in a more chic form. This is the total device weight as part of our objective. We also wrote usability and instructions for use. We tested using the ISO 10993-5 assay that flexible polyacrylate resin and water washable resin passed the test. Here's a sterilization protocol that we wrote, and our competitors are the Water Flosser, MuGuard, and Buccal Dose, but not all of them meet the mark like we do for targeted, personalized, sensitive, and translational medicine. We also wanted to identify a chronic disease management market. Here's our R&D timeline. This is our go-to-market strategy and our estimated quarterly growth analysis. The lessons we learned, including communication, real-world problem solving, and task prioritization. And here are our next steps.